Good morning. While my presentation is about COVID-19, so how many of you got the infection before? I think many of us, okay? So this is a bad news. It's a morning bad news for you. The new COVID-19, in this study, as we are in the era of COVID-19, so it's a new disease for our community. So we are responsible of what's new in our ophthalmology world. So we did this study. The objective of this study is about is there a direct or indirect relationship between COVID-19 and ocular diseases, also if there is a special or specific eye disease with COVID-19 disease or any significant relationship between them. So here it's a background about the disease itself. It's SARS-CoV-2 virus enveloped RNA virus. So the first doctor died from coronavirus is ophthalmologist. You know this. Even in Arabic, even in the world. So the eye is an portal of entry and reservoir for viral transmission of COVID-19. So this is the timeline and how COVID-19 developed from January 2020, and the research began from the first day of the COVID-19. So this is the day 1, day 8, day 10. This is the sign and symptom of COVID-19. There is a fever, dry cough, dyspnea, pneumonia, and gastrointestinal disease. Here, we did this study as a prospective cross-sectional study in Erbil Teaching Hospital and Ophthalmology Department between June 2021 and April 2022. So we recruited this patient in non-probability convenient sampling way. The inclusion criteria, this patient that got COVID-19 infection between 1 month up to 3 months. We exclude those patients who got the infection after 3 months. Also, we exclude the patient that have another eye disease or another ocular disease or on vaccination. We exclude these patients. Okay? Any patient with history of ocular trauma or recovered from COVID-19 also excluded. Here the result analysis. Really this is demographic data, male and female, and also the age group. We don't go through it because we have short time. This is also by symptom. Most of them had foreign body sensation, periorbital swelling, blurred vision, lacrimation. But the most common symptom at that time is blurred vision. And also followed by foreign body sensation, red eye, lacrimation, periocular swelling, diplopia, ocular pain, frequent blinking, and nystagmus. Really, this nystagmus, this patient is me. I have vestibular problem at that time, so I got nystagmus at that time. By the ocular manifestation itself, we have the most common one is the posterior subcapsular cataract, followed by multiple punctate epitheliopathy, follicular conjunctivitis, and CRVO. We have a lot of manifestation, as you see here, but the most or the more frequent one, the posterior subcapsular cataract, multiple punctate epitheliopathy, follicular conjunctivitis, CRVO, optic neuritis, chronic dacryocystitis. So here is all the patient and their manifestation. Also, so why COVID-19 is important? This is the point. This is the discussion. Why the patient got cataract after COVID-19? For example, why he's got CRVO after COVID-19? باختصار, COVID-19 is a multi-systematic disease, causes variety of ocular clinical symptoms and complications. Blurred vision and conjunctivitis like feature are the most common ocular presentation. Posterior subcapsular cataract, most common diagnosis made are these patients. COVID-19 is a systematic disease, has oxidative stress either for the our body or the lens or the eye. Also, it's a procoagulant status of the patient called CRVO and another PRVO and the vascular problem. So a recommendation, my sample that was about 75 patients. So we need more patients. The ocular manifestation during the early stage of COVID-19 infection, this is the recommendation. We need larger sample. Also long-term outcome of the ocular manifestation and possible ocular adverse effect of multiple vaccine. Okay, there is a study now about vaccination and ocular disease. And that's all. Thank you very much.